Have you ever thought about the incredible work your heart does every single second of every day? It is a powerful pump, sending blood rich with oxygen and nutrients to every part of your body, from the top of your head to the tips of your toes. This constant flow of blood creates a force against the walls of your arteries, and we call this force blood pressure. It is a vital sign of life, just like your pulse or your breathing. When we measure your blood pressure, we get two numbers. The first, higher number, is your systolic pressure, which is the force when your heart beats. The second, lower number, is your diastolic pressure, the force when your heart rests between beats. A healthy blood pressure is essential for your body to function properly. Hypertension is the medical term for high blood pressure. Imagine a garden hose with the water turned up too high. The constant, intense pressure can damage the hose over time. In a similar way, when your blood pressure is consistently too high, it puts extra strain on your heart and your blood vessels. This sustained pressure can cause damage throughout your body, weakening arteries and making your heart work much harder than it should. It is a condition that affects millions of people around the world, yet many do not even realize they have it. This is because high blood pressure usually has no warning signs or symptoms, which is why it has earned a very serious nickname. This condition is often called the silent killer, and for a very good reason. You can feel perfectly fine, full of energy, and have no idea that a dangerous process is happening inside your body. There are no headaches, no dizziness, and no shortness of breath in the early stages for most people. The damage happens slowly and silently over many years. This is precisely why understanding and checking your blood pressure is so incredibly important for your long-term health. It is one of the most powerful and simple steps you can take to protect your future well-being. Without regular checks, you are leaving one of the most critical indicators of your health completely to chance. So, who is most at risk? While anyone can develop high blood pressure, some factors can increase your chances. Sometimes it runs in the family, so if your parents or siblings have it, you might be more likely to as well. Our age also plays a role. As we get older, our blood vessels can become stiffer. But very often, our lifestyle choices are the biggest influence. Things like eating too much salty food, not getting enough physical activity, being overweight, drinking too much alcohol, or experiencing chronic stress can all contribute to rising blood pressure. The good news is that many of these are things we have the power to change, putting you back in the driver's seat of your health journey. For many years, doctors have used specific numbers to understand if a person's blood pressure is in a healthy range. Recently, in 2024, experts have updated these guidelines to make them simpler and clearer for everyone. Understanding these new categories can help you and your doctor make better decisions about your health. The first category is now called non-elevated blood pressure. This is the ideal range you should aim for, where your reading is below 120 for the top number and below 70 for the bottom number. Think of this as the green light for your circulatory system, showing that your heart and arteries are not under any undue stress. It is a fantastic goal to maintain throughout your life. The next category is called elevated blood pressure. This is when your readings fall between 120 and 139 for the top number, or between 70 and 89 for the bottom number. This range is like a yellow warning light. It is not classified as full-blown hypertension yet, but it's a clear signal that your blood pressure is higher than it should be. It tells you that now is the perfect time to start making positive lifestyle changes to prevent it from getting worse. Your doctor might talk to you about your diet, exercise, and other habits. For some people who already have a high risk of heart problems, a doctor might even consider starting treatment at this stage. The final category is simply called hypertension. According to the new 2024 guidelines, you are considered to have hypertension if your blood pressure is consistently 140/90 or higher. This is the red light. A reading in this range means the pressure in your arteries is dangerously high and needs to be addressed promptly to protect your health. When your numbers reach this level, your doctor will almost certainly recommend starting treatment, which usually involves a combination of lifestyle adjustments and, in most cases, medication. The goal is to bring your blood pressure down to a safer level to reduce the strain on your heart and blood vessels. If high blood pressure is left untreated, it can lead to very serious health problems. The constant high pressure can damage the delicate lining of your arteries, making them more prone to a buildup of fatty plaques, a condition called atherosclerosis. This can narrow the arteries and lead to heart attacks or strokes. The extra workload on your heart can cause it to become enlarged and weak, leading to heart failure. Furthermore, hypertension is a leading cause of kidney disease, as it can damage the small blood vessels responsible for filtering waste from your blood. It can also affect the blood vessels in your eyes, potentially leading to vision loss. These are serious consequences of a silent condition. The most important first step in managing your blood pressure is to know your numbers. Since hypertension is silent, you cannot rely on how you feel. You need to check. The great thing is that checking your blood pressure is easy, painless, and widely accessible. You can get it checked at your doctor's office, at many local pharmacies, or even using a reliable home blood pressure monitor. The new guidelines strongly recommend using out-of-office measurements like with a home monitor because it gives a more accurate picture of your blood pressure throughout your daily life, away from the potential stress of a clinic visit, sometimes called the white coat effect. Keeping a log of your readings can be incredibly helpful for your doctor. One of the most effective ways to lower your blood pressure is to look at what you eat, especially your salt intake. Too much sodium, which is found in salt, makes your body hold on to extra water, and this extra fluid increases the volume of blood in your bloodstream, raising your blood pressure. The new guidelines recommend aiming for about 2 grams of sodium per day. This means more than just putting away the salt shaker. Most of the salt we eat is hidden in processed foods like bread, soups, sauces, and ready meals. Try reading labels and choosing low-sodium options. A brilliant tip is to use a salt substitute, which has been shown to help lower blood pressure and reduce health risks. Moving your body more is another cornerstone of blood pressure management. Regular physical activity makes your heart stronger. A stronger heart can pump more blood with less effort, which decreases the force on your arteries and lowers your blood pressure. The goal is to get at least 150 minutes of moderate intensity exercise, like brisk walking, cycling, or swimming each week. That is just over 20 minutes a day. It is also beneficial to add some resistance training, like lifting weights or using resistance bands, 2 or 3 times a week. The key is to find an activity you genuinely enjoy, as that makes it much easier to stick with for the long term. Beyond diet and exercise, other lifestyle adjustments can make a huge difference. If you are carrying extra weight, losing even a small amount can significantly lower your blood pressure. Limiting your alcohol intake is also crucial, as drinking too much can raise your blood pressure over time. Finding healthy ways to manage stress, such as through mindfulness, yoga, or spending time in nature, can also be very beneficial. And if you smoke, quitting is one of the single best things you can do for your cardiovascular health. Each of these changes is a positive step that empowers you to take direct control over your well-being and reduce your risk of future complications. Making positive lifestyle changes is always the first and most important step in managing blood pressure. For many people with elevated readings, these changes alone might be enough to bring their numbers back into a healthy range. However, when your blood pressure is in the hypertension range, 140/90 or higher, or if lifestyle changes are not lowering it enough, your doctor will likely recommend starting medication. This is not a sign of failure. It is a proactive and necessary step to protect your body from the long-term damage that high blood pressure can cause. The primary goal of medication is to help you reach a safer blood pressure target and maintain it consistently. Doctors have several types of safe and effective medications to treat high blood pressure, and they will choose the best one for you based on your specific health profile, age, and any other medical conditions you may have. Common first-line choices include medicines like ACE inhibitors or ARBs, which help relax your blood vessels. Another group is calcium channel blockers, which also help widen blood vessels. Diuretics, sometimes called water pills, help your body get rid of excess sodium and water. The new guidelines often recommend starting with a combination of 2 different medicines, frequently in a single pill, as this is often more effective and easier for people to take regularly. Once you start taking medication, it is vital to take it exactly as prescribed by your doctor, even if you start to feel better or your blood pressure readings improve. High blood pressure is a chronic condition, meaning it needs lifelong management. The medicine is what is keeping your pressure under control. Your doctor will work with you, monitoring your progress and making adjustments to your treatment plan as needed. This partnership between you and your healthcare provider is key to success. Regular follow-up appointments and home blood pressure monitoring will help ensure your treatment is working as effectively as possible with minimal side effects. Taking charge of your blood pressure is one of the most powerful investments you can make in your future health. It all starts with knowing your numbers. I encourage you to get your blood pressure checked regularly, whether at the doctor's office or with a home monitor. Talk openly with your doctor about your readings and your risk factors. Do not be afraid to ask questions. By understanding what your numbers mean and taking early action through simple lifestyle changes and, if needed, medication, you can protect your heart, your brain, and your entire body for many healthy and happy years to come. Your health is in your hands.